So starting off with the murmurs, at least if you don't know anything about the murmurs, you can tell the site and the type of the murmur with a little bit of the information. So first is the what are the areas of the auscultation of heart. See, one thing you need to know that the areas of the auscultation of heart and surface anatomy of the valve are different things, right? So surface anatomy of the valve is a bit different from the auscultatory areas of the heart. So we need to know the auscultatory areas, that is the aortic, pulmonary, tricuspid and the mitral, right? So aortic is the second intercostal space on the right side at the sternal border. Just at the where the sternum actually ends, it is the area where we can auscultate for any pathology of the aortic valves, right? Then we have the pulmonary. Pulmonary is same as aortic. It is also present in the second intercostal space at the sternal border, but on the left side. Okay. Now tricuspid and mitral area. See, tricuspid and mitral area both are present on the left side of the chest. You need to know tricuspid is not on the right side of the chest, it is on the left side of the chest. It is in the fourth intercostal space at the sternal border. Okay, and the mitral area is basically in the fifth intercostal space where actually our apex is present. So we say it is just medial to the mid-clavicular line. If we draw a line from our clavicular at the midpoint of the clavicular, it is just medial to the mid-clavicular line. Okay, so we can see here that aortic area, we can hear the sounds of aortic stenosis and aortic valve sclerosis. Pulmonary area, pulmonary stenosis, or any. Okay, this is higher level. Just leave it for a second. Okay, then tricuspid, we have the tricuspid regurgitation, tricuspid stenosis. Then we have the mitral regurgitation, mitral valve prolapse, mitral stenosis. Now, everything related to mitral will be heard in the mitral area, and corresponding to every valve, the pathology will be heard in that area. Okay. Now, how to tell what type of murmur it is? Okay, just a basic information. Number one, if I talk about the regurgitations, now if I show the regurgitation here, right? Regurgitation is something when the blood from the ventricle, the right ventricle, will actually go into the left, oh sorry, the right atria, right? The blood, the gush of blood is coming from the right ventricle to the right atria because the valve is not good enough to close properly. So regurgitation is occurring. When does the regurgitation occur? Regurgitation occurs when the ventricle contract, right? When the ventricle contract, the regurgitation occurs. So that means if I talk about that regurgitation, the tricuspid and the mitral regurgitations, that is the TR and the MR are actually systolic murmurs. This is the thing that we got to know. Okay, these are systolic murmurs. Okay, now the second thing is if we talk about the stenosis in the lower two valves. Okay, stenosis is the blood is not coming properly because the valve is stenosed. It is not properly opening up, right? So less of the blood is going into the pulmonary and the aortic vessels. So that means it is occurring when does the blood pass to the vessels? When the ventricle is contracting. So ventricle is contracting, the blood is not able to go through this valve properly because of stenosis. So in case of pulmonary and aortic stenosis, the murmur will come whenever there will be the contraction of the ventricle. Okay, so pulmonary stenosis and aortic stenosis, these two are again systolic. Okay, these two are again systolic. Now you need to know which are the systolic murmur. So the valves that are present on the upper side, that is the TRMR, right? Okay, these show the regurgitation, and the valve, that is the pulmonary and aortic, the outlet valve showing stenosis. These whole thing have the systolic. This whole pathology, these four pathologies have the systolic murmurs. Okay. Now, now if I ask or if I tell about the tricuspid stenosis. Now, stenosis means the blood from the tricuspid valve is not properly coming into the ventricle. So, this blood flow is not occurring properly. This blood flow is not occurring properly. When does the ventricle filling occur? Whenever there is the relaxation of the ventricle. So, at the time of the filling of the ventricle, we have the relaxation of the ventricle. We have the relaxation of the ventricle. Okay. So the ventricle is relaxed, but the blood is not properly coming from the atria to the ventricle. So due to stenosis, this murmur will actually occur when the ventricle is relaxed, when the ventricle is in diastole or diastole. Okay, so the TS, the stenosis, the TS and the MS, whatever we are talking about TS, the same will apply to the MS also. So these two are actually the diastolic murmur, the diastolic murmurs. And similarly, opposite to this, in the case of pulmonary and the aortic valves, whenever there will be regurgitation, regurgitation is coming back of blood. The blood will always come back to the ventricle whenever the systole came to the end and the ventricle is very much relaxed to have the blood into it. So whenever the pressure in these vessels are high and the ventricle is relaxed and having the low pressure, then the regurgitation will actually occur. So in the case of pulmonary regurgitation and in case of aortic regurgitation, we will have the diastolic murmurs. So if I tell, so as a summary, okay, the we have the TS and MS and PR and AR as diastolic murmurs. Now opposite to that, TR, MR, PS and AS as systolic murmurs. So at least you need to know that which pathology is having what type of murmur. See, you will be asked not like this, that what are the diastolic murmurs. It is a very less chance question, but you will be more asked about the what are the murmurs in the MR, what are the murmurs in the AR. Like this you will be asked. Now we know what is the type of the murmur. Okay, now we have done the aortic stenosis. Okay, ejection murmur, that is the systolic murmur, right? Ejection is a word. Whenever we use the ejection murmur, ejection is a word that is used in the case of valve from which the blood is going out of the heart. So for the case of the pulmonary and aortic valves, we will use the word not systolic but ejection murmurs, right? You can use systolic, no matter, but ejection murmurs are used. Okay. Now, rest will be uh, rest will be covered in the next part. Okay.